talk about the last two papers that you just published. So would you tell us a little bit about the EXPOSS study and its findings?
Yeah, so this was a study which, in my mind, was kind of a long time coming. So people supposedly screen the spine when they have an extremity patient, but there doesn't seem to be any kind of data to tell people, is that a frequent thing that people coming with extremity pain where it's supposedly coming from the spine? Is it a rare thing? What's the kind of prevalence like? So that was the first question, was about sort of prevalence of this situation where somebody comes in with isolated extremity pain. They're convinced it's coming from the extremity, or their physician is. And this was kind of one of the inclusion criteria. So they come in with this pain, and we use, as practitioners using the McKenzie method, we go through a systematic way to sort of screen the spine. And if the patient's symptoms change as we move the spine around, and then we move on and look at the spine and treat the spine. If things don't change, then we basically go on and treat the extremity. So we wanted to find out, when you look at the knee or the ankle or the elbow or the shoulder, what sort of percentage of patients are we looking at here? Because we could all recall, I remember that great patient I saw a month ago, and she came in with elbow pain, and we moved her neck around, she got better. How commonly does that happen? And we have this recall bias, of course, where we think it happens very, very commonly, but we're not really sure because we don't sort of keep data. So we had 2 centers in Canada, 1 in the US and 1 in New Zealand. So 4 clinicians, consecutive patients coming in with isolated extremity pain that were recruited. And then we went through the MDT process of screening those patients to see if the problem was coming from the spine, from the thoracic spine or from the lumbar spine. If we found they were coming, the problem was changed as we moved the spine around, then they were treated by doing repeated movements with the spine. If not, they were classified and treated as an extremity problem. And then we followed those patients. We did compare the groups, not that it was that wasn't the main purpose, but we were comparing the groups really to give some verification for the fact that this, if this was really a problem coming from the spine, then we would expect it to be at least as good as, in terms of outcome, those where we treated the extremity. If we'd completely got it wrong, then we wouldn't expect a good outcome. If we were treating the spine and it was an extremity problem, we would expect a poor outcome. So we wanted to do that comparison just to kind of verify that we were likely sort of on track in terms of our finding the proportions. So that was the basis